Well, that's great. Thanks for having me come today, and really pleased to be giving some information about the vaccinations. It seems like just yesterday that we were wondering whether the vaccinations were even sort of on the horizon and where we were with the vaccinations. And so it's very exciting that they've come and that they're very quickly being rolled out. I recognize not quick enough for what we would like, but having said that, things are happening so quickly. And like Carol said, changing by the hour. And so it's really important just to sort of, hit the pause button and to just stop and really think about what are these vaccines? How do we know that they're safe, and to recognize that a lot of people have questions about the vaccines, and think very fair to be able to get those questions answered before we sort of ask people to go and get vaccinated. One question that came up before we even started today was whether or not I've had the vaccination. So I was lucky enough to be on one of the early lists to go and get it. So I had it a little over a week ago, and other than a extremely minor sore arm that did not stop me from doing any of my normal activities, I had no other side effects, and tolerated it quite well. And my personal decision was that I thought that it was safe, and I proceeded with that. So with that introduction, just a bit of a disclaimer that each person may have their own individual sort of health histories and everything else, and I'm not going to speak sort of through this to any one particular condition. And obviously, if you're complicated in terms of your past medical history, then you need to go and see your doctor and talk to them. And nothing that I could say here could be a substitute for that kind of conversation to happen. So just a couple of really quick facts about mRNA vaccines. So mRNA vaccines are both of the two vaccines that are out there. That's the type of vaccination that it is. These particular vaccines have been developed over 30 years, but there's been some recent advances in RNA technology and chemistry. That's one of the components of the vaccine that's allowed it to now be delivered sort of much more successfully than it ever was before. And that's why we're just starting to see them for the first time. There's been clinical trials for other viruses, including influenza, Zika virus, CMV, rabies. There's actually been a bunch of work on MERS, which is very, very related to the COVID-19 virus. So lots of information that's been out there and lots of study that's been done before we've even heard of COVID-19. It's also been extensively studied and tested in the treatments of cancer, and that's still one of the more promising sort of avenues for these types of vaccines. And so we may be seeing them in the future for all kinds of different treatments that we're not even imagining now. And lastly, this is a very important point, it's not a live vaccine that's just somehow been disabled or weakened, and it's not a killed vaccine like many of the traditional vaccines. And that makes it much safer, because it means that there's absolutely no chance that you can get illness from getting this vaccine, because it doesn't have the full virus in it. It only has some very small components. So how do mRNA vaccines work? So the first thing is that you're given an injection, usually in the upper arm. And once that injection goes in, the injection consists of some mRNA together with what's called a lipid coat that sort of goes around that mRNA. You can see sort of a picture of that in the middle of the screen. That coating sort of protects the mRNA from the environment until it's in the cell and allows it to be delivered into the cell. And once that mRNA is in the cell, then it's the instructions for our cells to make a harmless piece of what's called spike protein, which is one of the proteins that's normally found on the surface of the vaccine. It's the protein that allows of the virus. It's the protein that normally allows the COVID-19 virus to get into the cells. So after the protein piece is made, then the cell breaks down the instructions and gets rid of them. So they never make it into the nucleus where our DNA is. They never combine with our DNA. They don't in any way alter our DNA or anything permanently in our cell. It's just sort of a temporary instruction set that's there to tell the cell what to do. That protein is then displayed on the surface of the cell, where the immune cells can come and they recognize that there's something that's foreign there, and they build an immune response against that, particularly antibodies, which then provide some immunity and keep us protected from the COVID-19, which is exactly what would happen if we were infected with virus in real life. The difference is that we're only infecting with this very small piece of protein that causes no damage to our body or to our cells, but does allow our body to be able to learn how to fight COVID-19. So there's two mRNA vaccines that have been approved at this point by Health Canada. The first is the Pfizer-BioNTech, and the second is the Moderna. Both of them are extremely highly effective, about 95% effective, and there's very little differences in terms of effectiveness between the two vaccines. Both of them require 2 doses, which are given a different number of days apart. The Pfizer vaccine, and many of you know this already, needs to be stored in a -70 freezer, which is not our typical freezer, but it's a freezer that's usually used for biomedical research, and there's only certain facilities that have that type of freezer. And once we take it out of the freezer, it's only stable for very short periods of time in a fridge. In the case of the Pfizer, 120 hours. Where the Moderna one's stored in a -20 freezer, which would be a more typical freezer that almost every institution would have, and it's stable for up to a month in a fridge. So that means that it's much easier to transport and bring the Moderna vaccine to different facilities than it is for the Pfizer vaccine. That being said, there's a lot of work at the moment being done where the Pfizer vaccine can be thawed while it's being driven to a facility, and then the pharmacist at that facility can put it into solution and get it ready for injection, and it can all be done within the time frame when the vaccine is still viable. And so there may be some instances where, in fact, we're able to move the Pfizer vaccine to institutions, and that is being looked at as a possibility since we're trying to get as much vaccine to as many people as we can as quickly as possible. Both of the vaccines were very extensively studied before they were approved. So in the case of the Pfizer vaccine, there was over 43,000 trial participants and over 30,000 for the Moderna. So in total, over 70,000 people that were studied before it was approved, and many, many more since then that have had the vaccine. And both of them are approved for adults. There are ongoing studies looking at whether or not they're safe in children, and we hope that to be the case, but right now they're only approved for adults. So this is just a quick slide to show who was in those studies, those 70,000 people. So it did involve people from many different race and ethnic groups and from many different countries, but the majority were from the US and the majority were white, but there were many other groups that were represented as well. And of particular importance is that there was a very wide range of ages all the way up to 91 years old. And so it was actually tested on older adults, which is very important because often trials exclude that age group. But since they're a prime candidate for these vaccines, then it's important to know that it's been studied in that group. And this is the slide that was published to show that the vaccine actually works, that it's efficacious. And so along the axis on the side is the incidence, the cumulative incidence of COVID-19. So that is how many cases of COVID-19 people got during the trial. And then the blue line are the group that received placebo or didn't actually they got an injection, but it didn't actually have vaccine in it. And the red group are people that got the vaccination. And what you can see if you look in the little inset, which is just a blow up of the bottom part of the curve, both of them were exactly the same until just before day 12, when all of a sudden the group that got the vaccine stopped getting COVID-19, where the group that got the placebo kept getting COVID-19. And that's exactly what we were hoping for. You can see how that red line became almost flat. So it's not zero and it's not impossible to get COVID-19 when you've had the vaccine, but the numbers go dramatically down. And you can see that it really protects you from getting the virus. Some sort of highlights from that study. So that 95% success rate or the prevention of getting the virus was measured 7 days after the second dose. So although it does start to have some partial efficacy after 12 days, that full protection comes after you've had the second dose. The efficacy or how well it works in the age group of 65 and older was almost exactly the same as the younger group. So it worked really well in the older adults as well as the younger adults. And it was consistent across age, gender, race, and all of the different ethnic groups that were measured. And in the trial, there was a total of 10 people that had very serious illness. 9 of them were in the placebo group, and only 1 of them was in the group that had received the vaccination. And that makes us hopeful that not only does the vaccination prevent us from getting COVID-19, But if you happen to get COVID-19 and it doesn't fully protect you from getting it, that it seems to somewhat protect you from getting serious illness, although that's very small numbers and it's not enough to draw sort of a final conclusion from. One of the biggest things that people have been concerned about is adverse reactions or side effects from the vaccine. And so the most common side effect by far is just pain at the injection site. And I've already commented that that was one thing that I experienced. Many other people are experiencing symptoms like fatigue, headache, muscle ache, chills, joint pain, and fever. And all of these are normal symptoms that we would expect to happen when the immune response sort of kicks in and when your body recognizes that there's something foreign that's there. So in fact, this tells us that the body is recognizing it and that it's working. And almost every vaccination that's out there has similar side effects to this. So they're not surprising, and they kind of go hand in hand with making those antibodies that protect us from the illness. This is a slide that shows the side effects of different vaccines that you may have heard about. On the right-hand side is just placebo, and you can see even when people just get placebo, it still sort of irritates the body and causes some side effects, even when there's nothing in it except for just salt water solution. The flu vaccine has about 14% overall of side effects. The Pfizer vaccine is about 26%, very similar to the Moderna vaccine. And the Shingrix, which is the zoster vaccine, is a little bit higher than that. So these vaccines are somewhere in the middle. They're not the ones with the least side effects, but they're certainly not the ones with the most side effects. And overall, they're very well tolerated. The one big contraindication, or the one big reason why we can't give this vaccination to people that's come up, and you've probably seen it in the news, is that if you have an allergy to any component of the vaccination. And that's led people to wonder, what is in the vaccination and is it safe? So first of all, this reaction is extremely rare. In all of the doses that's been given, there's only a very small handful of people that this has happened to. And all of the vaccination centers are set up with the appropriate medications and the appropriate tools to be able to treat anybody that has this. And so far, I don't know of any that's happened in our region at all, or even sort of in the province. So it's extremely rare sort of side effect. The components that are in the vaccination, the first is that mRNA, which is the instruction set. It's given a really fancy drug name, but essentially it's just that, that mRNA that I talked about before, that instruction set. There's lipids, which is the coating that goes around the mRNA to protect it and to deliver it to the cells. And you can see there's big, long chemical names there, but these are the same types of chemicals that form the membrane or form the outside of all of the cells in our body, and in fact would be found in our body sort of on a regular basis. One of the ones you'll notice in the name there says polyethylene glycol, which is a component that we often use for laxatives. It's extremely well tolerated. It's in some cosmetics and that type of thing, but that's one of the chemicals that the very, very few people have a reaction to, but most people tolerate it just fine. And then there's a bunch of other chemicals that just make the vaccine injectable. So there's just a bunch of stuff there, like some sugars and potassium chloride and various other sort of water for injection. These are all things that we would find commonly in many medications. Some of them are on the shelf, even in our pharmacy here, and really nothing sort of unusual about any of those things. Of particular note, there's no mercury or aluminum or food allergens that are in this vaccine. And so it in fact makes it much safer than a lot of the other vaccines that are out there. So there's several things that we don't know from the studies of the vaccine. The first is that pregnancy was not studied. There were several participants of the trials that became pregnant during the trial, even though they were asked not to. And there was no adverse effects that were noted in that population. The Moderna vaccine has also had some animal studies done, not on the specific COVID-19 sort of vaccine, but on sort of that technology in general, which hasn't shown any harm. But overall, we don't know for sure if it's safe in pregnancy. So depending on your risk, this is one case where you'd have to have a discussion with your doctor and decide sort of the risks versus the benefits and decide whether it'd be right for you if you're pregnant or if you're planning to become pregnant. Same thing for breastfeeding. Not studied in children under 16 for the Pfizer and 18 for the Moderna, as I mentioned already. Patients with autoimmune disease and who are immunocompromised with conditions like HIV or other things, There were a few people like that were in the trials, but mostly, especially the autoimmune diseases, were excluded from the trials. So we just don't have data. So far, there's been nobody that's shown that there's been any adverse effects in those groups for people that have received it. And again, there's circumstances where you and your doctor might decide that it's right for you, but there needs to be an individual conversation about that. And that's supported by the National Advisory Committee on Immunizations, which is a advisory committee to Health Canada and sort of helps to make recommendations around when immunizations are safe or not safe. I mentioned before that there's some data suggesting that it might protect us from severe illness, but the numbers aren't high enough to be able to draw a firm conclusion about that, but we're quite hopeful. And most important, can we still be a carrier, or can we still be contagious and give other people COVID-19 after we've had the vaccine? So the vaccine itself does not make us contagious, but if we're exposed to COVID-19, we don't yet know whether or not our body is able to fight the virus fast enough to prevent it from passing on to someone else, or whether there may be a short window where we can still pass it on to someone else before the body sort of gets it under control. And so for those reasons, we're still asking people to have PPE, and we're still asking people to be tested, even if they've had the vaccination, until we have more information. And hopefully there'll come a time when that's not necessary, and when overall the number of cases of COVID-19 is reduced. But for now, that's still necessary, just because we're gathering information about that. So there's been several sort of myths that have been circulating about mRNA vaccines. I've tried to encapsulate some of them here. There's many others that I didn't put on the slides just in the interest of time. But the first is that, mortality or dying from COVID-19 is low. Why should I be vaccinated? Or another variant of that is, am I better off to take my chances that I'm going to, get COVID-19 and just, accept that if it happens, versus getting the vaccine, which, we don't know very much about. So the first thing is, we do know quite a bit about the vaccine, and we do know that it's quite safe and it has been extensively studied. But the flip side to that is that COVID-19 symptoms can be quite significant. They can persist. The symptoms can persist for months. You can have fatigue. You can have some shortness of breath. You can have what we call sort of brain fog, which is a confusion that sometimes comes along with COVID-19 infections, and can last for months or sometimes even be permanent. And this is even in young, healthy people that start off with fairly mild symptoms. There's been some data that shows that there's some lasting changes to the heart tissue, or it can damage the air sacs that are in our lungs. And most significantly, there's also appears to be some damage in some people that happen in the brains. Even if the COVID-19 virus doesn't make it to the brain, there's still some damage to the blood vessels there that can cause, that brain fog. It can cause strokes, it can cause seizures, and you can get something called Guillain-Barré syndrome, which is a feared complication of vaccines. But in fact, we're not really seeing it with the vaccine, but we definitely see it with COVID-19. And so your risk is much higher if you actually got the virus. And lastly, we have to think about not only ourselves, but the fact that we're in a population of people, and as healthcare providers, we're in contact with very vulnerable people. And so we're not only protecting ourselves from it, but we're helping out, the whole community, and we're helping out those vulnerable patients that we're looking after. And that's another reason to consider getting vaccinated. The second myth is that COVID-19 vaccines will give me the disease. And hopefully after I've described how it works, you'll understand that you only get one very small protein from the virus. And in fact, it's impossible to get the disease from the vaccine. The third myth is that COVID-19 vaccines will change my DNA. And again, we talked about the fact that that instruction set never comes in contact with your DNA or changes it, or leaves any sort of permanent changes in your system apart from the antibodies that your body learns to make in order to prevent infections with the COVID-19 virus. The fourth myth is that the risk of getting side effects from the vaccination is intolerably high. And so while there are some side effects from the vaccination, most of them are just the immune system kicking in, and it's quite safe. The one thing that has been in the literature in terms of side effects is there has been some instance of a condition called Bell's palsy, which is when the nerve in your face malfunctions and you get a drooping of one side of your face. And this, originally people were wondering whether or not this was from the vaccine because it was seen in people that were in the trials. But in fact, when they looked at the number of people who got this condition compared to the number of people who, get it just as regular chance in the community when they haven't had a vaccination, the numbers were almost exactly the same. And the conclusion at this point is it's probably completely unrelated to the vaccine, and it probably just happened completely by chance and people would have gotten it anyway. So they're continuing to monitor that, but really not a big concern about that or about any of the other side effects. So it's still very safe. And the last thing is that vaccines were fast-tracked and are not well tested, but all of the usual steps for a new drug to be approved were taken. Health Canada and other regulators around the world sort of examined the data as it was coming out instead of waiting for the trials to be completed. They prioritized it over other work because it was so important. And any steps that needed to happen where they could happen sort of concurrently instead of one after the other. And as long as it could do that and still be safe, then they tried to sort of get rid of some of the administrative barriers just so then that way we could get the vaccination as quickly as possible. But in no way was safety compromised, and they didn't sort of, skip steps or do things that didn't lead to sort of good conclusions. So overall, I'm quite satisfied that the vaccines are quite safe. There's been a frequent question that I've been getting, so I put it on a slide here. There's been several variants of COVID-19 identified, including the UK variant and more recently the South African variant. So these do involve the mutations to that spike protein that's used in the vaccination. There are some travel-related cases of the UK variant that have been shown in Ontario. There's no, to my knowledge, any Ontario cases of the South African variant at this point. So the question is, does the vaccine work against those variants? And so the expert consensus is that it's still quite effective against the UK variant, and we're good there. Still people concerned about whether there might be lower effectiveness, not zero effectiveness, but lower effectiveness for the South African variant. That's just based on expert opinion about where the mutation is, and we don't know that for sure. But either way, hopefully we won't get that variant here, and if we do, then we'll have to take measures to sort of keep it contained, and the vaccine will, we hope at sort of minimum provide some protection against that. Viruses also regularly mutate, and it's possible that at some point in the future, there'll be enough mutations that we have to sort of remake a new vaccine, and you'll have to be given a booster shot of a new vaccine in order to provide ongoing protection. But these are things that we'll think about sort of in the months and years to come, and worry about them as the time comes. But for now, this vaccine is the right one for what we're seeing in our population. So my conclusion then is that the benefits of the COVID-19 vaccine far outweigh the risks. And for the benefits of the vulnerable patients we serve, we should all very seriously consider being vaccinated. So I'll stop there, and Nikki can tell me if there's any questions.
There are a couple. Is it okay to take Advil before the injection?
Yes, absolutely fine. Take Advil or Tylenol. If you're somebody that typically sort of gets a reaction, you can take it before you get the injection, or you can take it shortly after if you're having any symptoms. No problem at all.
Are any of these ingredients related to the gadolinium contrast dye used for MRI?
No, there's no association that I'm aware of at all. So if you've got an allergy to that, important to point out that you've got the allergy, because you may be somebody that's more prone to allergies, and they may decide to monitor you a little bit longer, but would not be a reason to not get the vaccination. But you do have to make sure that you make it known so that people can be extra cautious with you.
Is the 95% efficacy rate less, more, or equal to the efficacy of most other vaccines?
It's a very efficacious vaccine, so it's the same or higher than most vaccines. There are some that are better, but overall it's extremely effective. And they were hoping for something that would be 50 or 60% effective, and we got something that was 95% effective. So this is as good a result as we ever even dreamed of.
So the next question is, if you put immunocompromised or suppressed on the consent form, will they still give you the vaccination?
So as I said before, you absolutely have to have a conversation with your doctor. If you're somebody that's going to RVH to get the vaccinations, then what we're told by them is that if you can attest to the fact that you've had a conversation with your physician, and both your physician and you together decide that the vaccination is right for you, they will still give you the vaccination. Having said that, my advice would be contact the vaccination center before you go and just notify them that you are one of those exceptions, just so that they can have some pre-knowledge of it and know to spend a little bit more time there. And also, if it's possible to get that in writing, it's not necessary, but it just may make the whole process go more smoothly, and it's probably worthwhile if it's possible to do. But absolutely, you need to have that conversation with your doctor and just make sure it's right.
Just a couple more. Will this be an annual vaccine like the flu shot?
It's possible, but at this point we don't know, and really depends on at least two factors. So the first is whether or not the virus changes from year to year. And the second is, how much, and whether or not there even is virus out there, whether it sort of goes away after we've had sort of vaccinations and with all of the other measures that we're taking. And then the second part of it is, we don't really know how long our immune systems are going to continue to remember how to make all of those antibodies. We can measure the antibodies in our blood, but even when the antibody levels go down, there is evidence that when we're reinfected, that the body still has a memory of how to make them and can start making them again. So only time will tell. There's close monitoring of people that have been vaccinated to see, over months and years, if they start to get COVID-19 again. And if they do, then certainly we'll look at doing sort of booster shots and that type of thing. But at this point, we don't know for sure.
I think you've sort of addressed this, but if you want to become pregnant, is it safe to take the injection?
Yeah, so the recommendation currently is not to get pregnant within a few months after you've had the vaccination. If that's something that doesn't fit within your plans or timetable, then again, I would encourage you to sort of talk with your doctor about the risks and benefits of one way or the other. But the current recommendation is not to get pregnant after you've had the vaccination.
Will those receiving the first injection automatically get the second? What happens if were unable to have the second within the time frame?
So great question. So when you go to get your vaccination, and as we roll it out with patients, we're going to do the same thing. We're just automatically booking you for the second one. And so unless you miss that time frame, then you'll get it. On the off chance that there's something happens with the supply and it's delayed, then that will be sort of looked after, and there'll be mechanisms to sort of rebook that, but we're not anticipating that would happen. And if something happened, you missed the slot for whatever reason, we do think that, even if it's delayed by several weeks, that it wouldn't have any sort of big impact, and you'd still be absolutely covered and still be absolutely fine. There are countries around the world that are looking at delaying that second dose for as much as 3 months. And there's some concern among the experts whether, many months might be too long between the two doses, and that hasn't really been decided. But in Ontario, we're currently not contemplating any delays that would be that long, and we're currently trying to get everybody to have that second dose in the recommended time frame.